Good evening. As a future healthcare provider, I find it important to know the current causes for disease in America today. One of these causes, according to the CDC, 1 in every 3 Americans adults has hypertension or high blood pressure. And because of this, it's vital to be able to monitor your own high blood pressure, as chronic hypertension or high blood pressure can cause other diseases such as heart disease, heart attack, stroke, and kidney disease. Not only hypertensive patients, but also other patients should be monitoring their blood pressures because of these risks. There are 4 easy stages or steps to take your own blood pressure. The first step is to put the patient in position. So most readings are taken with the patient sitting down with their both arms relaxed. You can take it either on the right or the left. And it's also important to have a good relationship with your patient, as nervousness can also increase your blood pressure. The second step is to put the blood pressure cuff on their biceps. So you want to fit it just snugly around their biceps with the cords hanging down and the place that says artery with the arrow just above their elbow crease, as that's where the brachial artery is that we'll be getting the reading from. Step 3, you can relax your arm. Step 3 is to put the stethoscope on the corresponding areas. The earpieces go inside your ear with the earpieces pointing out. The bell goes away from the patient and the diaphragm goes directly onto the brachial artery. And the third step is to pump. You want to pump it to about 180 millimeters of mercury for a normal patient. If you know that their patient has chronic high blood pressure or is at risk, say if they're overweight, then you probably want to get it to about over 200 millimeters of mercury to get an accurate reading. Once you've pumped it to that level, you gently release the nozzle, and the first pulse that you hear, you record. And that'll be your first number. And the second, when the pulse disappears, that'll be the second number. Alright, once you're finished, you can take it off. And finally, to understand what you just read, the first number corresponds with, is called systole, and it corresponds with the heart contraction pressure. The second number is diastole, and it corresponds with the pressure of the heart when it's relaxed. And for the average American, healthy American, 120/80 is our normal blood pressure. Once it reaches 140/90, that's stage 1 of hypertension, and there are 5 stages, increasing with severity. If you get a reading of 180/110, first verify that it's that high by having the patient relax and then taking it again, because they may be nervous or have just stood up or did some sort of strenuous activity. Once you verify that, contact your emergency services, as that's a hypertensive crisis. So now that you know how to accurately take a blood pressure, go ahead and take it on yourselves and take it on other people's to monitor. Because according to the Mayo Clinic, there are other ways besides monitoring your blood pressure to keep your blood pressure down, which would be monitoring your food intake, exercising, reducing your sodium and caffeine levels, and also if you smoke, quit smoking. And those levels that I had mentioned before were from the American Heart Association, and there are other information that you can get from the American Heart Association if you have any more questions on heart disease or blood pressure. All right, thank you.